Hi everyone, my name is Mia Harris and I did my case presentation on asthma. Asthma is a respiratory disease that involves a periodic episode of severe but reversible bronchial obstruction in people with hypersensitivity or hyperresponsive airways. Asthma is characterized by inflammation of the respiratory mucosa with edema, contraction of the smooth muscles leading to narrowing of the airways and increased secretion of thick mucus in the air passages. This leads to obstruction of the airflow and decreased oxygen supply in the body. There are two types of asthma, extrinsic asthma and intrinsic asthma. Extrinsic asthma involves acute episode triggered by type 1 hypersensitivity reaction to an inhaled antigen. People with extrinsic asthma usually have a history of seasonal allergy or hay fever and sometimes eczema. And the onset for extrinsic asthma usually occurs in childhood, but some patients no longer experience this type of asthma when they enter puberty or adolescence. Intrinsic asthma begins in adulthood and it is caused by trigger of hyperresponsive tissues in the air passages in response to stimuli such as respiratory infection, exposure to cold, exercises, medications such as aspirin, stress, and irritants such as cigarette smoke. I'm going to get right into the case study, try to make this as short as possible. The patient is Aaron Jones. He is a 35-year-old male. He's an office worker. He lives alone, has no children. He takes good care of himself. He loves to play sports, and he's very healthy, non-smoker, and has no history of allergy or other medical condition. But he does have a family history. Both parents have seasonal allergies, and they also have asthma. So Aaron has been on a long vacation to Mexico from December to January, and he returned to the United States, particularly in Minneapolis, where he decided to resume his normal activity. The weather in the state where he lives is getting very cold, and Aaron began to notice that he has been experiencing frequent productive cough, shortness of breath, and difficulty sleeping. So he goes to the ER. In the ED, he endorsed multiple symptoms such as chest tightness, fatigue, lightheadedness, shortness of breath with labored breathing. Upon physical exams, Aaron was found to be anxious and irritable. He was having some tachycardia with a heart rate of 130. Tachypnea or hyperventilation was also noted with a respiratory rate of 24. Blood pressure slightly elevated, but not too bad. Wheezing was heard upon auscultation. Increased thick mucus production as he was coughing a lot and having productive cough. And also he's beginning to hypoventilate, which led to cyanosis and hypoxia with a O2 sat of 89. So he was in acute respiratory distress and was having trouble speaking in the ER. So some diagnostic tests that were done for this patient included chest X-ray, CAT scan, which show airway inflection, bronchial thickness, atelectasis. Also, the pulmonary test, also known as the spirometry test, was done for him, and the ratio was 40%. The normal for this test is 70. So the FEV1 and the FVC ratio was 40 for Eric, and this indicated bronchial constriction. He was also having some respiratory acidosis with a PaCO2 of 60. The normal for this lab is 38 to 42. He was also having so the PaO2 was 50, and the normal for this lab is 75 to 100. So based on all of this, we can say that Aaron is diagnosed with intrinsic asthma. The onset for this type of asthma is in adulthood and can be exacerbated by cold weather. As we can see, Aaron is 35 years old. He's an adult and began experiencing symptoms when he returned to the cold weather. He also had all the subjective symptoms of asthma, which are shortness of breath, difficulty breathing, chest tightness, and difficulty speaking, which are all manifestation of airway obstruction. He also presented with fatigue and lightheadedness. This can be caused by poor oxygen supply to the brain and other tissues due to poor gas exchange in the alveoli of the lungs. He was also anxious and irritable. This is associated with asthma exacerbation and respiratory distress, leading to the release of stress hormones such as adrenaline, which caused his heart rate to be elevated. Also, hypoxia was noted with Eric. Hypoxia can stimulate the heart to beat faster as it attempts to deliver blood to oxygen-deprived tissues, as we noted with Aaron. One of the initial responses to asthma attack is tachypnea or hyperventilation, as the body tries to compensate for the drop in the O2 sat. But respiratory acidosis and hypoxia develop as it becomes difficult for air to pass through the narrow and obstructed bronchioles. As we know that with Aaron, he had an O2 sat of 89, so he was hypoxic. Also, the diagnosis of intrinsic asthma was further confirmed with the expiratory wheezing on auscultation as the air tried to escape through the narrow passages in the lungs. Also, the chest X-ray, CAT scan, and pulmonary tests also confirmed the diagnosis of asthma. So the chest X-ray and the CAT scan showed atelectasis, which is collapse of the alveoli, and bronchoconstriction, which is due to bronchospasm, inflammation of the mucosa and mucus plug. So the pulmonary test, which is also known as the spirometry test, confirmed obstruction of the airway with a decreased ratio of the FEV1 and the FVC ratio of 40%. So this test is done to measure the airflow into the lungs. So the FEV1 is the forced expiratory volume, and it measures the ability to expel air from the lungs in 1 second, compared to the total volume that can be expelled. The FVC stands for the forced vital capacity, and it measures the total amount of air that can be that a person can expel with maximum effort. So this test is done by breathing into a spirometer, which measures the total amount of air that lungs can expel. So the pulmonary test is considered the best tool for asthma diagnosis because it measures the amount of air that can be expelled from the lung. And with asthma, wheezing is heard on expiration, indicating airflow obstruction. So basic information about how can this be treated. Bronchodilators can be used. It's a short-acting beta agonist medications, which are such as albuterol, can provide rapid relief by relaxing and opening the airways. Long-acting beta agonists, these are medications that can be used in combination with inhaled corticosteroid for long-term asthma control. The leukotriene modifier are oral medication that can be used to reduce inflammation in the airway, and the oral corticosteroid are also used for severe asthma attack and for short-term. The oral corticosteroid are used for severe asthma attack and short-term use to quickly reduce airway inflammation. So just please print out the notes and read along. And I don't know why this is blurry, but this is the end of my presentation. These are my references, and thank you for listening. Okay.